joined by she will be assisting me in restraining the animal. Today we'll be conducting a full physical examination with vital signs taking and restraining methods. So let's begin.
The first step of the physical exam process is the signalment and the history. So this is where I would ask the owner some basic questions about the patient. Our patient for today is a 1 year and 4-month-old intact male Shih Tzu. He is an inside dog with 3 companions. He has a regular rice diet and eats twice a day normally. He has no medical history. He is still intact. He is up to date with vaccines and he has no current medications. His chief complaint or main reason for his visit is he's weaker than normal and he has loss of appetite. The next thing in the physical exam process is to observe the general appearance of the patient. Tootsie's body condition score is a 4 using the standard 9-point scale. His mentation or level of consciousness is quiet, alert, and responsive or QAR. I then let him run around to observe his posture and gait, which is normal. By performing the skin pinch test, I checked his hydration status and got adequate. Now we move on to taking of vital signs. First is body weight. I unfortunately do not have a weighing scale at home, so I improvised and assumed his weight is around 14 pounds. Then I got his rectal temperature and it came out to 38 degrees Celsius or 100.4 degrees Fahrenheit. Next, I got his heart rate via auscultation and counted for 15 seconds, got 16, then multiplied by 4 and got 64 beats per minute. Same thing with respiratory rate, but counted using my hands and got 36 breaths per minute. As for perfusion indicators, the mucous membrane color is pink and the capillary refill time was less than 2 seconds. Now we can begin with the systems or head-to-toe examination. Starting with head and neck, I assess the face, head, and eyes, looking out for any abnormalities, discharges, inflammation, or redness. Same thing for the nose and nares. Next, I examined the oral cavity, which included everything in the mouth. Then I examined the ears, the thickness of the pinnae, and cleanliness of ear canals. Lastly, I palpated the submandibular lymph nodes, salivary glands, and trachea. Secondly, we move on to the trunk and limbs. I firstly inspected the body for symmetry, masses, and tenderness. Then I palpated each limb and joint in weight-bearing and non-weight-bearing positions and observed the muscle mass and tone. I checked the feet and nails. I then examined the skin and hair coat for alopecia, masses, parasites, dryness, excessive oil, and matting. Then I palpated the pelvic region, the vertebral column, and the 5 peripheral lymph nodes. Next, we move on to the thorax region. I began by palpating the thorax and the area between the 4th and 6th intercostal spaces on both sides of the thorax for the point of maximum intensity of the heartbeat and any cardiac thrills. I then ausculted the heart on both right and left sides of the chest, watching out for a heart murmur. Then we move on to the abdomen. I assessed for distension, deformity, displacement, symmetry, bruising, and intestinal hyper or hypomotility. I used 2 hands to palpate, beginning at the spine and moving ventrally, allowing the abdominal viscera to slip through my fingers. I did the same throughout the abdomen, noting organ size, location, and the presence of fluid, gas, fetuses, masses, or feces. Lastly, we examined the external genitalia and perineum. Around the prepuce, penis, and testicles of the patient, I checked for hair mats, hernias, feces, masses, tumors, inflammation, and evidence of discharge. After the physical exam is done, I will hand the patient over to the veterinarian to perform needed procedures, like cephalic venipuncture, as shown by my assistant using the sitting restraint.
So that concludes the physical examination, taking of vital signs, and restraining methods. Thank you for watching and goodbye.